Hi, I am so delighted to meet you in the program of Horse and Heart News. 2 days before, we received a case of upper GI bleed. Finally, she has been found to have severe gastric erosions with endoscopy, possibly due to NSAIDs, aspirin. So, in fact, she has been recommended aspirin for primary prevention of cardiovascular event in diabetic. Being diabetic, she has been recommended aspirin, and moreover she had been taking this aspirin for past 4 years. Now the question arises, is it justified to recommend aspirin as primary prevention for cardiovascular event in diabetes? It is well known that or well recommended that aspirin should be taken for secondary prevention of cardiovascular event in diabetic. Those who have had CVA or MI or peripheral vascular disease like cardiovascular event, then to prevent recurrence of this event, they should be recommended aspirin. But now the question is, those who have not had any cardiovascular event in the past, for the sake of primary prevention of cardiovascular event in diabetic, whether are we justified to recommend aspirin as primary prevention of cardiovascular event in diabetes? It has been conducted almost 3 large randomized controlled trials, namely Aspirin and Arrive and Ascent. So all these 3 large RCT revealed that the beneficial effects of aspirin to prevent cardiovascular event as primary prevention in diabetic is simply nullified by adverse event. They mean adverse event is GI bleeding and extracranial bleeding. So whatever the beneficial effect, whatever the reduction of cardiovascular event because of introduction of aspirin has been neutralized by GI hemorrhages primarily. So now it has been clearly stated that unless it is clearly warranted, then you should be very cautious in putting aspirin for primary prevention of cardiovascular event in diabetes. So where it is strongly indicated as a tool for primary prevention, in diabetic individual, if they have additional risk factors including family history of premature cardiovascular disease and hypertension, smoking and obesity and microalbuminuria. So when they harbor one of these risk factors, then if they have multiple risk factors along with existing diabetes, then they say that you can recommend aspirin. But most of the time, the recommendation of aspirin for primary prevention in diabetic must be a shared decision with the patient and patient's relative. Very interestingly, microalbuminuria poses one of the risk factors for development of cardiovascular event in diabetes. So we generally do microalbuminuria or albumin creatinine ratio as a part and parcel of investigation of diabetes. When they have persistent microalbuminuria after excluding the causes of transient albuminuria like UTI, cardiac failure and prolonged standing, then we think that this persistent microalbuminuria heralds the onset of progression of chronic kidney disease, or it simply foretells us the patient may be going for development of cardiovascular event in future. In these situations, basically aspirin is strongly recommended. So what are the individuals in whom better to avoid aspirin? One, if age group is more than 70 years and those who have history of upper GI disease, especially peptic ulcer disease, and history of bleeding disorder, any history of current malignant hypertension, then better to be careful about administration of aspirin. So the primary prevention of cardiovascular event in diabetes may warrant aspirin, but it must be a shared decision and you should take it into account of all the factors. Thank you.